Time now for our daily rising crisis update, and we will start where we always do with the most up-to-date numbers, if we can put those up. Let's look here in the United States. We're at 1.2 million cases. That is an addition of 23,800 since yesterday. We've now surpassed 70,000 deaths. Specifically, we've had 71,077 people die. That's an increase of 2,200 individuals since yesterday. Horrible numbers there. So for the world, 3.6 million cases worldwide, an addition of 100,000 since yesterday, 256,851 deaths, an addition of more than 5,000 since yesterday. These numbers are incredibly dire. And Saagar, I was looking at an analysis. If you look overall at the nation, some of the numbers seem to be flattening out or even declining. If you take New York and New Jersey out of that analysis, where obviously they've had a strict lockdown and they've been starting to flatten and see declines there, if you take those numbers out, you're actually seeing increases in the rest of the country. So it just goes to show you we are still very much in the midst of this thing right now.
Yeah, exactly. And that's right, because there was probably more strict lockdown, but not just lockdown, it's more social observance. Is that when people feel like in New York, in the middle of a full-blown pandemic, people are going to be like, oh, I'm not going to take this. But if things don't seem as serious around you, that's part of the dangers of this virus, because of its exponential growth. It can go from nothing to everything in just a matter of weeks. And so that's unfortunately what you're going to see across the country. And one of the things we were worried about, we covered this mutation yesterday. Well, there's new possible evidence, this is in the New York Times, that children are falling ill with a baffling ailment that's related to coronavirus. And it's known as somewhat similar to Kawasaki's disease. It's a mysterious ailment with a new syndrome that's only been cropping up right now among children on Long Island City in New York and a few other hotspots around the country. And they afterwards they have signs of enlarged coronary arteries. That's one of the symptoms. And it leaves them ill, some in intensive care. No children are yet to have known to have died so far. But it goes to show you that coronavirus is not something that just happens and goes away. There are after effects. And one of the great blessings, at least, was that kids did not appear to be dying from coronavirus. But there could be something of an inflammatory response or something else that's being triggered in a certain subset of children. Yeah, and they're really trying to figure out what's going on here. Cropped up in Europe first. It doesn't always come with lung issues. Of course, that's a hallmark of coronavirus. It's a different set of symptoms that they're dealing with here, but something to keep an eye on. Something else we've been covering here, of course, extensively, is who's getting the money and who is not getting the money in terms of the federal coronavirus relief response. New analysis shows that small businesses, of course, we know that the small business PPP program radically underfunded. The initial tranche we went through like that. The next tranche, still not sufficient. Don't know why it's capped at all, to be perfectly honest with you. But a new analysis shows even though New York and New Jersey have been the hardest hit areas and states in the country, their small business owners are at the bottom end of the spectrum in terms of getting those PPP loans. Why? Well, the guess, and this is borne out by data, is that because there are so few community banks in that area, that those small businesses have not gotten the attention. So what the big banks did, it appears, and based on some journalism on this regard, it seems like the big banks went to their big customers first that qualified for the PPP loans. They got the concierge service. In fact, they had specific protocols. They could kind of jump the line to be able to get their money first. And since New York and New Jersey are so served by so many of the big national players rather than the community banks, the small businesses there have disproportionately suffered. Yeah, this is really disgraceful. I mean, you can just see exactly how through the implementation. And again, this is not something that would happen with an uncapped program, because the banks would give concierge service, but then everybody else would still be able to apply for money. But when you turn it into a winner-take-all lottery system, then we know when systems are structured already to their benefit, then this is just how it's going to go. And it's just a terrible situation. Like you said, New York and New Jersey, two of the hardest, most clobbered states by this thing, getting the least amount of money doesn't make any sense to me. Does not make any sense. All right, thank you for watching today's Crisis Update. We'll have another one for you back here tomorrow.